Today we are going to study about gingival enlargement. Gingival enlargement is basically a condition in which hyperplasia of the gingival tissue is taking place. This means that the number of cells in the gingival tissue is increasing, and when the number of cells are increasing, it will lead to increase in the size of the tissue as well. So in this condition what happens is that your gingiva, it gets enlarged and it doubles its size at times. Now if you see towards the grading of gingival enlargement, it can be of 4 grades: 0, 1, 2, 3, 4. It's 1, 2, 3. Then in 0 it is no enlargement, that the gingiva is completely normal, there is no enlargement seen. In 1 only the papilla is going to get enlarged. Now what is that papilla area? This is the papilla area, the interdental papilla, what you say. This is the papillary area. So when only the papilla is going to be enlarged, that is what you say as grade 1. In grade 2, you will see that your papilla along with the marginal gingiva is going to be enlarged. And in grade 3, more than 3/4 of the crown surface is going to be covered. So at times, the gingiva can be so enlarged and swelled up that it can cover your entire tooth surface. Now, if you see, the gingival enlargement have been discussed in various categories. The classification for this is the inflamed gingiva, the drug-induced gingival enlargement, idiopathic gingival enlargement, neoplastic gingival enlargement, false gingival enlargement, and the conditioned enlargement. Looking to the first one, which is the inflamed gingival enlargement. Now, as the name is only telling, inflamed is a condition in which certain kind of trauma is caused. So what happens at times, what do? We take pens and pencils, or maybe the bobby pins, safety pins, and we start digging our gums. Now that is a kind of trauma which you are providing to your gums. This trauma can further lead to the gingival enlargement, and this is how it looks. This condition can either be localized or generalized. Here, usually when the interdental or the marginal gingiva is enlarged, that is what you say this condition is. Ballooning of the gingiva will be seen. Also here, if you see, the gingiva has become really fibrotic. That is one thing to remember. Moving to the other type, which is also the most common and the most important type of drug enlargement, that is the drug induced gingival enlargement. Now basically there are just three type of drugs which are responsible for it. The most important is the anticonvulsants, which is the phenytoin. Now phenytoin is a drug which has got this as a major disadvantage, that it leads to gingival enlargement, right? Other than that, there are calcium channel blockers given to heart patients, immunosuppressants mainly given to children, and that is something that can lead to gingival enlargement in children. Now if you see the features here, initially it is going to be a painless swelling. It comes till the margin, but here a very important point is that it will have a beaded appearance. So if you see to the gingiva, it will give you a beaded like appearance. So you see this is this bead like appearance which is seen here. This is the characteristic point of drug-induced gingival enlargement. It can be seen as a mulberry shaped if compared. This is a pale pink color. Why do we have pale pink color? Because the vessels are actually getting constricted here, due to which the blood flow is going to get decreased, and that is the reason we see a pale color of the gingiva. If you see, the oral hygiene and eating is compromised, because at later stages the condition can be extremely painful. It might bleed very badly, so that is the reason that the patient is not able to eat anything or brush and maintain his oral hygiene. In the later stages, I've already told you, it can be painful and it can bleed. One very important point here is that the fibroblastic activity is increased in this condition due to the defective collagenase formation. Now as the activity has increased, it will lead to more fibrotic changes, and so the gingiva here becomes very fibrotic to touch. Moving on to the next type. Okay, if I talk about the treatment for this, usually when the drug is subsided, in the next 1 to 8 weeks, this condition is solved. Other than that, we can also go for gingivectomy. If you see the idiopathic, so the term idiopathic itself means something that is hidden. You don't exactly know the cause. So when you don't know the cause behind gingival enlargement, that is what you say as idiopathic gingival enlargement. Again, it can be fibrotic, and the enlargement here is going to be so severe that it reaches the attached gingiva. It is going to be firm and pink in color. Leathery appearance will be seen, which is again a characteristic point. Usually it is seen in cases where the teeth eruption is taking place. Treatment again is the gingivectomy. If we move to the another most common, the second most common and most important is your systemic condition, gingival enlargement. Now see what happens. In certain condition, the hormone level gets disturbed, and because of these hormone changes, there is this gingival enlargement which could be seen. Now what could be these conditions? For conditions like pregnancy, puberty, vitamin C deficiency and allergy could be some conditions. Particularly if you see in the pregnancy, so usually the gingival enlargement would begin at the third month and can go up to the 8th month. Now in the first trimester and in the third trimester, you know that surgically treating something is very difficult and is almost contraindicated. So we will go with simple scaling, and that too the scaling will be done for short appointments. So for example, in one appointment only one quadrant will be covered. If you see for puberty, it is again hormonal changes. Vitamin C deficiency causes scurvy. It is going to be an extremely bleeding condition. Oral health is completely damaged here, and what you can do as a treatment is give vitamin C supplements to the patient. Other than that, you have allergy that could be responsible for the gingival enlargement. If you see the clinical feature, here you have this characteristic tumor-like enlargement of the gums. See, the gums, if you see, they are very prominent and very aggressively enlarged, okay, and they are bleeding badly. So it is giving you a tumor-like appearance. Now coming to the next thing, the vascularity here increases and the epithelium thickness is decreased. Now imagine that the thickness has decreased and the vascularity has increased. In such scenario, what is going to happen is it is going to bleed very easily. The gums will bleed even when you're eating something. So that is what happens. Next thing, as I said, that the bleeding is going to get increased and you might see bluish color gingiva, particularly in the scurvy conditions. You can see this. Now treatment is going to be according to the condition, and scaling is what we recommend in the cases of pregnancy. Next, what you see is neoplastic gingival enlargement. In neoplastic gingival enlargement, this is mainly related to some kind of tumor in the body. So if there is some systemic illness like tumor or certain cancerous condition, then this enlargement can be seen. Now this can be because of both benign or malignant cases. Like the benign cases here could be epulis, as you can see in the picture. It very much appears as a gingival enlargement, but it is localized. At the same time, it is certain malignancy which is happening or certain kind of neoplastic growth which is happening. In this image, you can see that fibrosis could be another. The fibroma can be another type of gingival enlargement which is related to the neoplastic gingival enlargement. Now coming to the false enlargement. In the false enlargement, you can see the word false is telling you that this was not actually a case of gingival enlargement, but it was falsely assumed to be one. Usually if you see a child whose teeth are erupting, then the gums around the teeth, they get swelled up. Okay, and once the teeth have erupted, this swelling subsides. So this can give you a false visual that the gums are actually enlarged or certain kind of inflammation of the gums is taking place, but this is completely natural, as it is the tooth which is enlarging, as the gums are enlarging because of this tooth, and once the tooth is erupted, this is going to subside. So no treatment is needed as such. So at the time of erupting tooth, you can see this tori, Paget's disease, cherubism, fibrous dysplasia. In all these conditions, when the enlargement happens, it is a false enlargement because the reason here is something else. Now here also we can go for systemic treatment and gingivectomy. Like in the Paget's disease, you know, there is this calcium misbalance which is happening, right? So you can give calcium supplements here to the patient. Moving on to one main treatment for almost all these kind of gingival enlargement, that is known as gingivectomy. Now as the term itself is telling you, it is related to cutting of the gingiva. So what do we do in gingivectomy? We surgically cut the untreated or the diseased gingiva, which is the enlarged part. We can do this by three methods: by the conventional scalpel method, then we have lasers, in which the diode lasers are the most common ones used in perio, and in electrocautery could be done. What do we do in electrocautery? We basically burn the tissues. So there is this very bad smell of the burning tissues which could be felt. That is the only disadvantage. Otherwise, both of these conditions are going to provide provide you a bloodless field which is very easy to operate, and the post operative complications are also going to be less. So this is one treatment, gingivectomy. Other than that, systemic treatment will help a lot, and we can also go with scaling and root planing. So like scaling and root planing is like a must in every case. So that was all about gingival enlargement. I hope the topic is clear, but still if you have any doubt, let me know in the comment box and leave your reviews. Thank you.